Hi there, I'm very excited to welcome you to another exciting edition of Lifelines with Mima. Today we'll be dealing with the issue of infertility and how it affects us today. Of course, you know, clients are already waiting for us to attend to them. We're going to have doctors in the house to explain some of these things to us and deal with some of the misconceptions that we already have. Don't go anywhere, I'll be right back. Welcome back. We are still dealing with the issue of infertility and how it affects our world of today. Recently, we've had a number of clients come in complaining about how infertility is affecting their marriage. With me, I have the honor of presenting to you Dr. Osazuwa Henry. Thank you, sir, for coming.
Thank you very much.
Welcome. I also have, as usual, my dear husband, Dr. Maxwell Odiegwu. Sweetie.
Thank you.
Okay. This issue is, you know, it's affecting everybody. If your neighbor doesn't suffer it, your church member, your sister, your brother. What are the possible causes of infertility?
Infertility, one, let me start by saying that it's a very important topic to discuss.
Yes.
A reason is because in our environment, we like motherhood. We treasure motherhood. We also take children as something that it has to your worth. So those that have delays or are childless, there's some degree of stigmatization.
Yeah.
So that's why it's a very important topic to discuss. The causes, we can break down the causes because we like to look at infertility as a problem of the couple. It's better viewed as the man and the woman when they come together.
Yeah.
So we have causes that can arise from the man or the woman.
Okay.
And at times, their coming together can also create an issue. So let me just discuss the woman. For the woman, what we're worried about are infections that can affect the tubes.
Okay.
And these infections, a lot of times, they occur at a time years before the woman gets married. So a lot of times, she's lost track of
without
the
knowing.
triggers. Yes. So the setting that can easily cause infection is one, abortion. The one we refer to as criminal abortion. Criminal, often done in places that are unhygienic. There are improper precautions. So infection is often a complication.
Okay.
And because they are trying to hide it, they're also likely to go to all these drug outlets to buy inferior drugs. So that's one. Then another setting is what we refer to as pelvic infection, pelvic inflammatory disease.
PID.
That one is common with promiscuity. Because the pathogens that often cause it, they tend to move among people that are promiscuous.
Wow.
So that can also affect the tubes. Then the other setting is people that deliver in unhygienic environments can have infection after childbirth. Okay. So you see that in our environment, we have more of these kind of issues that can damage the tubes for the woman. Okay. So in my practice, a good number of clients, they have tubal issues. But there are other things that can cause infertility in a woman. Another common group is women that don't ovulate often. Okay. People that don't see their period often, they tend to fall into that category. Okay. So those ones, if you look at fertility, human fertility is not very efficient. Even if a woman ovulates every month, the chance of getting pregnant in a year probably about 6 days out of 365. That's about a week out of 52 weeks.
Wow, that's a lot.
It's not very efficient. So if a woman is not ovulating regularly,
it's even more difficult.
It crashes the probability. So that's another one. Then there are also other issues that can arise, like in our environment, we also have issues with fibroid. Fibroid can become so big, distorting the uterus, can also block the tubes, can create an unhealthy environment for the baby to implant. So that's another common subgroup that we find in our practice. And at times, as a consequence of abortion as well, instrumentation, the cervix can become blocked. And when it gets blocked, the sperm will not find access into the uterus. Then we discuss in our environment. People also seek traditional help when they have this kind of issues.
That's another big problem, yes.
Yes, and at times they can put caustic materials in the vagina. So at times it just blocks everywhere.
And they think that, you know, that's good.
Yeah, because at times those things, their initial reaction is to cause some bleeding. You know, we always believe that bleeding is like you're removing the bad blood.
Bad blood.
So it's almost as if this one is probably a good treatment. Whereas what you are creating a setting for problems later. So I think for the women, the lesson is issues with infertility are things that can occur years before you even get married. So you have to protect your motherhood from when you are young, because it can become an issue when you are now older and you're getting married. For the men, a lot of the issues with the men, they circle around the quality of the sperm.
Okay.
And that's where a lot of the issues operate through.
Come from.
So what we're worried about is the one that the sperm is very low or it's not there.
It's not there. What does that mean, sir? What does this not there
mean?
What
it means is that the part of the body that produces sperm is not working.
Wow.
So you have the semen coming out, but there's no sperm inside.
So you can't have children.
You can't have children. You can't have children. You can't have children. For the men, infection also plays another role.
Okay.
Gonococcal infection is an important one. So it also damages the passages where the sperm pass through, or it can also affect the testes directly. So for men, you see that for men and women, infection is something that plays an important role in both of them.
Yes.
And here we also have ineffective treatment. They go to the pharmacist, just get any drug.
Just
yes.
Give me ampiclox. Give me ampicillin.
There are other smaller causes, things like people that have torsion in the past when they were young. Okay. Those ones, they may never have a history of it. Only their parents will know that they had an issue and they had a surgery. So people that have had growing surgeries before, we're worried about them because may either have affected the testes or the passages where the sperm passed through may have been damaged in those prior surgeries. Some people have they have genetic issues. Okay. They are born with some kind of problems.
Born like that.
Yes, that affect their fertility. The good thing about fertility nowadays is that the treatment options are better. So now we don't even like to use words, terms like infertility because it's an absolute term. It means that you cannot. We prefer the subfertility. It means that you have a reduced potential, but you can get pregnant because of the treatment options, which I'm sure we'll discuss later.
Wow, that's okay. Doctor, you know, he talked about the causes of infertility in men and women. But how do you know? What are possible symptoms? How do I know that, you know, I have a problem and I should, you know, visit my doctor? What are some symptoms?
Yeah, well, are there really symptoms of infertility? From the definition, it says that when a couple is not able to achieve pregnancy after trying consistently for 12 months.
When you say trying consistently, what does that mean?
Yeah, well, for us, ideal definition of trying means at least there must be copulation or sexual intercourse 3 times in a week.
Wow, religiously like that?
Yes. The reason why it's extended to 12 months, as he said, is that the human reproductive system is highly ineffective. Okay. In a cycle, the chances of a couple that has been trying, even if it's every day, of getting pregnant is less than 20%. Wow. So
a healthy couple.
When you assume that everything is okay. So it means that you need to try not just for 1 month or 2 months or 3 months. In 6 months, maybe like 50% of the couple will have achieved the pregnancy. It will take another 4 to 5 months. That's like 10 months, 11 months before you can have 85%. Okay. That's if you assume that everything is okay. So it's highly ineffective. So it is after then we can now say there's some form of problems with fertility. That is when the gynecologist may now come in and say, okay, let us investigate and find out whether there are maybe problems. So like the symptoms, doctor, we've been trying.
It's not happening.
So the gynecologist now comes in and tries to investigate. Some of these investigations, because of the way in our environment, we start with the basic investigations. Yeah. Then if you do those ones and you don't see anything, you may now want to step up to, because sometimes you may want to put cost into consideration. Yeah, depending on how the couples come. So it's more like a stepwise approach. You start with the basic investigations. If there's nothing there, you may need to step up again just to see if there's anything. But we should also know that there's what we call unexplained infertility.
Okay, that's another angle.
You've done all the tests, everything seems okay, but nothing seems to be happening. Okay. So it's more like a diagnosis of exclusion. You keep on doing tests and tests until you try to see that's within the limits of the environment where you're practicing, within the limits of what you can afford and the available equipment.
What of complaints like painful periods, heavy bleeding.
Those are entities on their own.
Okay.
Painful period, when you have it, you know, when you see a couple, you want to ask those questions.
Okay.
There may be some association. I have painful period does not mean that you're not likely to get, but it may be a symptom of something. Maybe like endometriosis. You know, heavy bleeding may suggest.
What is endometriosis?
Well, endometriosis is not. It may be common here, but people don't really talk about it much. Even though some people are beginning to come out, when you have some tissues within the womb that will now end up in outside the womb,
where they are not supposed to be.
Yes, and the major symptom is pain. The pain, there's so much pain during periods, and in some people it may be severe enough for you to still have pain after the periods have ended.
Wow.
So it's just a life of misery. The pain is so much that you are not able to do much. In fact, it affects the quality of your life. So for doctors, you first of all want to deal with the pain because some of them will come even when they are not married yet. So you want to deal with the pain first before you now say, okay, when it's time for you to get pregnant, let us see how we can help you.
Can they really get pregnant? Can you get pregnant with that condition?
Yes, they can, but it's easier with assisted conception.
I see.
It's easier with assisted conception.
Okay. Okay, sir.
Yes, let me just, I wanted to just highlight something I just remembered.
Yeah.
In our environment, my patients have been seeing I think particularly the men, they have issues with performance, which can contribute significantly to infertility.
Yeah.
And I think they have this abnormal notion of what performance is. So when they get married, they can't meet.
Oh.
So what now happens is that they start having issues with direction.
Yeah.
So I've seen a number of them. So I think all these maybe Western movies, pornography.
Because they now have a particular standard that they think they should meet up with. And it's a bit psychogenic, if I may say. You want to now impress your wife, and in that bid is you are tensed up when it's time for you to meet it. And some people even believe that they probably need to meet their wives every day for something to happen. But it mustn't necessarily be so, especially when you are trying to have a baby. It can be spaced.
What differentiates you, both of you that are, fellows, consultants? I mean, okay, let me break that down. You finish medical school, you then go back and spend 6 to 7 years to specialize in a particular field, and you are given the title of a consultant. What is the difference between you and somebody that just has a lot of experience, finished medical school, didn't specialize, but has a lot of experience?
That extra 6 years, a good part of it, you are studying couples that have infertility and how to approach and manage them.
And you are just, that's why it's a specialization. It's about women and all the problems associated with women, both during pregnancy and outside pregnancy.
A large number of women and even men cannot do much about their situation because of how expensive it is to have fertility treatment.
What we advise is, it depends. The cost varies. Is when you get to the high end, that's when the cost really escalates.
Okay.
We usually advise couples that once they are afraid that there may be a problem, safer to seek expert medical care.
Immediately.
The care may not be too medicalized initially. It may just be to try and find out what the problems are.
Okay.
They need to spend some money, but not a lot of money. Because once you do the basic investigation, you check whether the sperm is good, tubes are opened, the ovarian function is fine. Once you can do those ones, you can now need to have a kind of a plan. Yeah,
it gives you an idea.
Yes, a plan and a kind of a timeline to achieve success. The problem we have is that some of them delay so long. You see a lady that has been infertile for, let's say, 10 years. It's coming when she's 43. At that time, the ovarian function has already declined. So it now becomes expensive. She would have gone through a lot of hospitals. When she brings her result, you see a lot of things. Nobody has been able to sit her down and tell her that, madam, whatever you're going to do, the earlier you do it, the cheaper. So it can become expensive once you get to assisted conception. Because it's not cheap. Drugs are expensive, the equipment are expensive. So even at that, when it gets there, it's also cheaper if you save your money towards it.
It's true.
Because at times you have absolute costs. So whatever you're going to do is not going to achieve anything.
You know
so
that it's a waste of time.
But if you move towards some people, they will collecting your money. They are taking your money, but not telling the truth.
They're not telling
when
the
you
truth.
put them together, you
They
see
will
that you
just
spend millions.
they know that there is a big problem. They want to hold on to you until they don't see you anymore. Then from the problem of delay, apart from the fact that they see hospitals, faith-based organizations are not also helping.
That's another thing.
Because it may just be superficial. You're not getting pregnant. Yes, we're all Christians, we pray, but at the same time, you should also try to seek medical help early. Sometimes you may know there is a problem from the beginning and you need to seek medical help, but you just feel that you need to wait. Yes, I need to wait a bit.
Pray until it happens.
Prayer is good, but at the same time, you must take a step of faith by taking action. And that entails seeing a qualified medical practitioner that they will give you a plan of how this issue can be managed.
Wow. We need to try and start seeing miracles in the actions of the doctors. That's where we're missing it.
Yes.
Because in my practice, I tell my patients that I can start giving a lot of stories, miracles. But a lot of us don't see it. God may be leading you to the doctor because that's where your miracle is. We have to see it like that. For me, medicine and religion is one and the same. There's no difference. It's God that gives us the knowledge. It's God that gives us the guidance. There are some things I do. I can't explain it medically, and it succeeds.
And it works.
I have a pastor's wife, infertile for 6 years. They've gone around the whole places. So they came, investigated, and there was already no problem. I did a scan for her. I noticed that the position was a bit abnormal. And I told her that, okay, meet your husband with your bladder full. She got pregnant the first month.
Wow.
6 years infertility.
Wow.
So that's a miracle.
Wow, it is.
So what happens is
I
this.
told her that it's a miracle.
Yeah, because of the knowledge. When the uterus is retroverted, that the position is behind. Because of the proximity of the bladder to the uterus. So when you have a full bladder, it pushes the womb so that it straightens it out.
You can just imagine.
It's easier for whatever to happen.
Wow.
So when she gave birth, the whole church members were in the hospital. I said it's a miracle because it's God that led you here. Because God knew that we're going to find that
and solve the problem.
And you've gone around the whole place.
I hope.
So we have to see God in the actions of the doctors. I agree that some doctors are ungodly, but a lot of doctors are godly. So we have to see it as such.
Well, this issue of IVF.
Yes.
I mean, having done a couple of cycles myself, battling with infertility for some time, tell us, what does it even mean to a common man? And then, is it true that, okay, babies from IVF are not good babies, they are not strong, they won't last, they'll have problems?
That is just a myth. And people need to be educated the more. IVF is science. It has been in existence for some time now. 1978 was the first time that the first IVF in the world baby was born. And she's even a mother of 2 now. You understand? In Nigeria, we have some people that are already championing IVF, and so many other centers are coming up IVF. Like, even at Medimax, we have an IVF center, and we have recorded a lot of successes.
Yes, I know.
As far as IVF is concerned. So people need to be educated. The problem is many people don't know about IVF until much later.
It's even too late.
And the time is of the essence. For the woman, the reproductive career is so short. From 35 and below, the potential begins to decline. And IVF success rate is dependent not solely, but majorly on the woman's age. So, in our practice, we see a lot of women that come through, and they say, what is, they don't even know anything about IVF. So we sit down, the counselor talks to them, then the IVF nurse also gives them information about what IVF is all about. It's also called test tube baby. What usually happens is that the commonest cause of IVF, of infertility in an environment when the tubes are blocked.
Yeah.
And luckily for IVF, you bypass the tubes.
Okay.
You don't need the tubes
To get pregnant.
to get pregnant.
Okay.
So what happens is that the woman is given certain medications, injections, and at a particular time, the eggs are now extracted.
Okay.
Then the man's sperm or seed is also gotten, and there's fertilization outside the womb in a test tube, an incubator. After 5 days, when the embryo, that's the early stages of life, has formed, it is now transferred back into the womb, and you will not expect it to grow.
Normally.
And, normally, after some weeks, a pregnancy test is done. Once it's positive, it's like any other pregnancy.
Wow.
There's nothing wrong with an IVF baby. From my experience, all our babies that have been born, they are very healthy.
Doing
We have
very
celebrated
several
birthdays and the rest. So, but some people still don't believe. They feel that as the baby is growing, maybe something will happen. But it's not always. It's not even the case at all. You know.
So, is there like an age that IVF will not work anymore?
Technically, probably there's no age. If you look at the options that are available, the technology that is available, it's just that morally, even medically, there's some people that you would advise not to approach motherhood.
Yes, like carrying the babies themselves.
Yes, like people that have medical conditions, advanced age, is safer. Safer.
So for their own health.
For their own health, it's safer not to.
So what can you do for them? Those kind of people.
For no, there are options in terms of having a baby. There are other options.
Okay.
Adoption is an option.
Okay.
But some people, what they do is that because they prefer the motherhood so much, they're willing to take the risk.
Wow.
Yes.
So you need people to advise them openly and sincerely that even science. Let me give you an example now. Let's say a 65-year-old woman getting pregnant. 65. You won't have a lot of scientific experience because people don't normally get pregnant at that age. So if I'm advising you to get pregnant at that age, I'm asking you to take a risk.
A big one.
Which I can't substantiate.
That's true.
Wow, that's true.
I think the lesson is for IVF, babies are the same. The only difference is how the egg and the sperm comes together. Okay. That's where science now comes in. Because once conception occurs, it's still nature that takes on.
That's true.
That's the fact. It's just the process, the mechanism for bringing the egg and the sperm together. That's what differs.
So because the options now, apart from the adoption, now we're having surrogacy. Yes, for those that cannot carry. So
surrogacy is possible in Nigeria?
Yes, it's very possible. It's very possible. We have had triplets on 3 occasions from
Medimax, yes.
Yes, so it's very, very possible for those that are not medically fit to carry these babies. Someone else
can help them carry
the babies. You know, and the documents are signed, so there won't be any problems
issues in the future.
Even though the laws for IVF laws, we are trying to promulgate something that is in the works. But for now, in order to protect your organization and the mothers to be as well as the surrogates, these documents are signed so that there won't be any. When the laws come on stream, there will not be any problems. Then adoption is also there, but the adoption process.
Nigeria, we don't.
I think because of
we're not